real life scenario with me and the crew I was working with. One of the most complicated choking situations we had with a child, 5-year-old little girl. We received a message on our MDC, our dispatch terminal in the rig. It said that sheriff was on scene and child was unresponsive and blue, literally as blue as this. Little Asian girl, about 5 years of age. She was sitting in a chair at an office with her mom eating grapes. She simply sat out of the chair. Once her feet hit the ground, that grape got lodged in her throat. She was that 1 in 5 children that would have died had we not shown up with secondary measures, because traditional choking relief measures, traditional choking first aid failed. The sheriff, mom, all the other folks on scene were trying back blows, chest thrusts, Heimlich, everything they could do, and it all failed. She was as blue as that bag. I turned left into the parking lot. There were a bunch of people in the parking lot. Sheriff literally hands me this little girl who is blue and limp. I kind of lost it for a second. The wires were a little bit crossed. Very stressful. Regained my composure. I did try back blows. I tried Heimlich. As my partner is getting out of the rig, bringing the equipment around, I laid her on the ground. As I had her in this position here, he hands me, once again, this child was going to be one of those one child that dies every 5 days. Traditional methods failed her. She was that 20-30% where traditional first aid, choking first aid failed, and she needed a backup. I truly believe this is the backup that can fill that gap for you until you're waiting for EMS. So we grabbed our paramedic tools, and I got down on the ground, head to head with her, scooped the laryngoscope in, lifted her throat up, and I looked down into her throat, and I could see a large green grape. I reached in there with the McGill forceps, which are curved tongs and pliers. Do not buy these things. You are not protected under Good Samaritan to use them, and you will probably injure or catastrophically injure or possibly kill that person because you're not trained on it. I pulled that grape out, and the reason I tell this story is because there's a huge difference between this tool and the tool we use as paramedics. As I pulled the grape out, she didn't start breathing. I think in almost every single video I've watched of adults, children, and infants where folks go straight to this device with an unconscious child, as soon as they place, press, push, and pull, once or twice, maybe the third time, the object comes out and that person starts breathing and crying immediately. With that little girl, she didn't start crying. We proceeded to start an IV, continue 30 compressions, 2 breaths. My buddy is giving her epinephrine. We're performing CPR. We're bagging her. Mom is screaming in the way that only a mom can scream as she's sitting here watching her blue and dead child have CPR performed on her. There's probably 30 or 40 people in the parking lot. Sheriffs were on the phone. Sheriffs were the dispatch. Sheriffs talking to the captain. Hey, we're going to block every intersection on the way to the hospital. We worked on this little girl for 2 minutes, roughly.